Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Study revives debate about unpopular diet for cancer patients. Oncologists have been moving away from the strict neutropenic diet, which requires cooking all food at high temperatures, as evidence suggested it did not actually help prevent infections. A new study published in the Journal of Clinical Oncology found that certain blood cancer patients who were allowed a less restrictive or liberalized diet had 11% more infections than those on the neutropenic diet. The study suggests that oncologists may need to reconsider how liberal they are with patient diets, as the benefits of a less restrictive diet in terms of nutrition and quality of life were not seen. The study had some caveats, such as differences in patient populations compared to previous research, but it has reignited the debate on the neutropenic diet. Experts note that a less restrictive diet may still be reasonable for some patients, like solid tumor patients, but the neutropenic diet may still be necessary for high-risk, heavily neutropenic patients. The bigger issue may be improving cancer treatments to be less toxic to the immune system, eliminating the need for strict dietary restrictions. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. /speak